I have another one of my guys who came in. He has no surgeries to do, and he's and here and live in the studio, and that's none other than the orthopedic for OrthoAtlanta, Dr. Donnie Fowler the third. What's going on, sir?
What's up, guys? Good to be here.
Good
Yeah,
to
we know
have
you.
you.
We know you're good.
Yeah,
So,
I might not have come in today if things had gone differently last night, but
so look, wait. I called yesterday. And I was calling him. Hey, calling. And he was just, yeah. Hey, everything good? Yeah. It's all right. Yeah. Now this is an hour, almost an hour and a half before the game. I'm getting my mind right for the game. But you know, Doc, I love it because that is me all of the way. That is me. The Bears playing.
Yeah, that's why I don't really go to sports bars.
Yeah, I can't go to sports,
to watch
right.
certain things.
no, same.
Somebody was asking me. I was like, it's not necessarily hearing the commentator, but that does help too because it kind
Yeah.
of helps with everything you're doing. But I can kind of think better without all of this, going on.
I don't want to throw a plate or nothing when I get mad and like I got pillows set just in case I throw my phone so I won't break it. So that's me. But anyway, first off, man, they won. I don't want to say they got lucky, but they won.
They let them know who because
We're
some
talking
people
about the
might
Duke.
not.
The Duke Blue Devils. But this all of a sudden this injury came up with Cam Reddish. They're saying that he might be his status is not clear. What they're saying is
His knee
His knee?
is what they're saying, but I mean, yeah, he obviously wasn't hurt last weekend when they played UCF. He kind of went through the week without any obvious reports of anything going on. It was truly kind of a shock, I think, to everyone where like 10, 15 minutes before the game, he wasn't out for the last warm-ups, and they reported he was going to sit with the knee. And I heard one thing say that maybe he heard it on Thursday. Someone else said maybe he heard it in the shoot-around. But they're not providing any information whatsoever. So I really don't know much of what to say at this point. I think they need him because he's arguably their best three-point shooter to stretch the defense. But I also wonder, and of course we were talking about this a minute ago off air, I have conspiracy theories. I think Coach K is a stand-up guy, doesn't bring negativity to players or the team, but maybe there's a small chance that there was some kind of team violation, some kind of breaking curfew, whatever it might be, where he said rather than announce that, we're just going to go with a knee injury and leave it at that. I don't know, and it's probably not that, but 10% of me thinks that could be the case.
He's also one of the best perimeter defenders. So
Yeah, that length.
That's big. Yeah.
all right. So let me ask you this: we saw the injury with Okiki and with the Auburn sophomore. The way it buckled.
Mm-hmm.
Why? What is it? What would cause that?
Yeah, I mean, I think his foot kind of slid. I mean, most of the time when you see an ACL and the way it buckled inward, my guess is MCL and probably medial meniscus too, all the structures on the inner part of the knee. But it's usually a non-contact type injury where your either foot gets stuck or it slips and you just get a sudden moment to your knee and it collapses down.
What
So
does it? Is that the type of injury where it can just happen to anybody and at any time, or is it because he's been dealing with something like in his?
yeah, I mean, certainly if you have a previous injury and things are a little weaker and you don't have quite the same stability, it can, make there a slightly higher chance, but it can happen to anybody at any given time. If you just catch your foot the wrong way and your knee buckles, then those ligaments are only so strong, and if you're moving at a high speed, unfortunately, something's going to tear.
Especially when I saw the play, like
Yeah.
it was like when you saw the replay, because with at normal speed you really couldn't see it. Like you were kind of like, but then when you saw that replay and his knee went in, you were like, like you knew
Yeah.
that he's not coming back. And here's the bad part about it: he's a sophomore. This is the end of the season, so like he's out, of course, all of next season, but it may go into the following season.
What did they come up? Did they say what is wrong?
They did. I mean, he's getting an MRI scan today. They haven't, at least as recently as 15 minutes ago, I didn't see anything reported yet. But.
Yeah.
Now with Giannis, he has a sprained ankle. Do you think he needs to rest before the playoffs, and how long? Because we do know this was the same ankle that was hurt
Yeah.
recently.
Yeah, and of course that's a big deal for them. And and he's, I think, come out and said, I'm not coming out of the starting lineup. I still want to play. Whether that happens is to be determined. Obviously, I think they ideally would like to have the number 1 seed kind of going in, and it's getting close. But I think the bigger thing is having him healthy for the playoffs. So I personally think you rest him now, because whether you're 1 seed or the 2 seed, if you got a healthy Giannis in the playoffs, you're going to be just fine. So.
I don't think it has anything to do with number 2 seed. He want to win an MVP. That's what he thinks.
That probably has something to do with it.
That's part of it.
But I mean, I guess I can understand that. However, I'm worried about this championship. Like, get healthy.
Right.
Get healthy.
No, I
for
feel
playoffs.
you.
And there's what about 3 weeks left, roughly somewhere in there. Sit out a week and a half. Like, you still can get the.
They got like 8 games left.
At the most 8. But
Yeah.
2 weeks at most.
Right. You can sit out a week.
Right.
Come back. And
Right.
he's not going to play the last week probably anyway. You know how they play them when it comes down to the last 4 or 5 games.
Well, what is the league, G? It's like 3-game league.
I mean, I think it's like a 3-game league lead. I'm going to look at it.
They almost brought him back in at the end of that game. Clippers were making a run. He came to the scores table, and then they hit a 3, and they sent him back to the bench. I don't know if you guys saw that. So, I mean, obviously he can play, but I think the better part of Valor is to rest.
Yeah, they're up 4 games with 6 left.
6 left. Yeah, he's good. All right. Speaking of the playoffs, we saw the gruesome injury with Yusuf Nurkic, the Portland Trailblazers center. Man, is he going to be able to make a full recovery?
Yeah, well, obviously, first thing with that kind of injury, you just hope for the players. You know, you feel bad for him. You hope for his health. Make sure everything goes okay. Gets back to walking, doing things. But I mean, I think he can. There's certainly an unfortunate blueprint of some high-profile guys that have done this with Paul George and Gordon Hayward. And I wouldn't say Gordon Hayward is quite what he was before. I mean, his first year back, but then again, I don't think Paul George was right back to where he was the year after, and look at him now. Right. So I think he can hopefully get there, assuming surgery is successful, there's no complications, bones heal up okay, but it's certainly going to take a long time.
Yeah, that was a huge injury for them. We know they have Enes Kanter behind him, but he was averaging a double-double. And what stood out to me is that he's a center. He was averaging, I believe, 3.3 steals. Like, that's almost unheard of for a center. So now this was when I heard about this, and also with that Nurkic injury, I didn't even rewatch it. Like, I didn't want to see the play once I heard how it was. Arizona Diamondback Steven Souza, he tore his ACL, LCL, partially torn PCL, and posterior lateral capsule tear. You think he'll ever be able to return? And if he does return, will he be playing at a high level?
And was it enough L's left? They just didn't put. Like, that's crazy. I can't believe that.
Is that not almost everything in there?
I mean, well, he didn't get anything on the inner or medial side. It was all, kind of ACL and then everything on the outer and back part of the knee. So he missed the very inside of his knee. But if you watched his compared to the Okiki, you saw Okiki's knee went in. Sousa's you saw went outward. So you rip all the structures on the out and the back. And really unfortunate. It almost reminded me, and granted his wasn't serious, if you guys remember back 2 years ago, Bryce Harper had a very similar thing running down to first base on a wet base. His knee slipped, buckled. He just had a bone contusion, but he still missed, I think, about 6 weeks. But yeah, Sousa obviously is a lot worse. He's out for at least a year with that amount of surgery to reconstruct. Wow. And yeah, he's I mean, it's better in a baseball player than a football player to have that kind of injury, to be honest, but it's still going to be a long road to recovery.
Right, because less cutting and things like that.
Yeah, that's sad, man. When I first saw it, I didn't want to look at it, because when you hear all of that, you he did something.
And he's a right fielder, so he has to be in that outfield. Like, I guess it's less than what a second baseman may have to do, like with the catches.
But Nurkic, I'm not trying to compare it like, well, he's better off. I'm just saying, was Nurkic just listen? Because you look at that, you hear all the ACLs, all of that. Was his worse than Nurkic?
I mean, it's one of those things you almost would rather it be bone than ligament or soft tissue, because bone, especially if it's away from the joint. Like his, I mean, granted, it was close to the ankle, but as long as it's out of the ankle joint, you're not affecting the joint, you're not affecting any ligaments. It's a much higher likelihood for return. When you're talking about a joint and destabilizing all the ligaments in your knee, that to me is a lot worse of an injury, believe it or not.
Right, because that bone, it comes
Yeah.
back. It's going to
Of
get
course.
back to where it was. The ACL is kind of,
All right, well, there you have it. My man, Dr. Donnie Fowler, the third. Make sure you all, if you're you have any type of injuries, especially if you need an orthopedic, check out OrthoAtlanta. Look him up. One of the finest. D said he's experienced them already, with family, so they're legit. So we're gonna take a quick break, and we appreciate you, sir. And we will be right back.
Have a sports injury? Need to see an orthopedic doctor? OrthoAtlanta is one of Metro Atlanta's largest orthopedic and sports medicine practices, providing orthopedic and sports medicine care for the whole family. With 37 physicians and 14 offices, the practice provides the highest level of care for injury of muscles, joints, bones, and spine. OrthoAtlanta offers convenient access to a full range of musculoskeletal surgeons and specialists. OrthoAtlanta also offers on-site physical therapy, pain management care, MRI imaging, and workers' compensation care. The OrthoAtlanta surgery centers in Austell and Fayetteville provide cost-effective, same-day surgical procedures in an accredited outpatient center. Hip, knee, shoulder, back pain? OrthoAtlanta has you covered with specialists in all areas. Same-day appointments, orthopedic care for the whole family. OrthoAtlanta, Atlanta's choice for orthopedic and sports medicine care. Learn more at www.orthoatlanta.com.